signature.
Hello everyone and welcome back to the 2019 Lymphoma Research Foundation Ed Forum. We are coming to you live from Chicago, Illinois. Now if you're just joining us for the first time, throughout the weekend we will be providing you with a series of discussions on lymphoma and the latest in lymphoma research. We're just about to start another discussion on the effectiveness of herbal remedies, supplements, and CBD. Let's head inside and listen in.
Share their time, talent, energy, and connections. That is really what everyone that's part of our community does. They just find their own unique way to support LRF. Whether volunteering at one of our events behind the scenes, making sure that everything runs effortlessly or smoothly, fundraising as one of our walk or ride teams, or creating your own Fundraise Your Way event. You are all a crucial part of our efforts to eradicate lymphoma, and we really could not do it without you. Volunteers are essential to everything that we do. So we can really never say thank you enough, but we've put together a Salute to Volunteers digital scrapbook, so please direct your attention to one of these screens, and let's hope this works. Oh. There's supposed to be music, but I guess you can enjoy the pictures without it. We can start over. Let's see if we can start over. Can we get any music from our AV team in the back? Maybe not. Okay, well, let's just enjoy some pictures of our volunteers. Thank you.
Well, thank you, Kaya, very much. I just want to reiterate, it's felt a little bit like a family reunion today, seeing so many wonderful volunteers who have participated in a lymphoma walk, cycled in the lymphoma research ride, or used their own creativity and talents to help fundraise through our Team LRF platform, which Kaya so wonderfully leads for us. So if you have any interest in volunteering, being a part of our team, we'd love to discuss that with you. We have a number of informational materials out in the exhibit area, and we appreciate everything that all of you do to support the Lymphoma Research Foundation. It's now my pleasure to introduce our next speaker, who will be speaking to us about herbal remedies, supplements, and CBD. I'd like to now welcome Trevor Christ to the stage to help lead our next plenary session.
All right, perfect. All right, perfect. Well, thanks so much to the organizers for inviting me and for everyone for being here today. So we are going to talk about herbal remedies, supplements, CBD oil, which is a big topic. So we have almost an hour. I'm going to talk for about 30 minutes, and then I have plenty of time for questions. And feel free to interrupt me. Too, just shout out. There's a big bright light in my face, so just shout out. If you have any questions as we go along, we can keep it interactive. So. All right, so my objectives today is I want to talk about some key definitions and as well as some statistics just to kind of introduce the topic and put everything in, put some background and some reference to what we're going to be discussing further on in the talk. Talk about some of the legal and regulatory oversights of herbal supplements and dietary supplements as well as CBD, and kind of contrast and compare to what this looks like compared to FDA-approved drugs. We're going to then, really the meat of the talk will be discussing some of the potential benefits and harms of herbal supplements, and then piggybacking on the CBD oil, especially with respect to cancer and lymphoma patients. And then I hope to wrap it up with some conclusions and some things that you can hopefully take home for yourselves or for patients you may be caring for, friends and family, et cetera. All right, so to start with some definitions, so dietary supplements legally require 4 components. So they're intended to supplement the diet. They contain 1 or more dietary ingredients. This could be vitamins, minerals, botanicals, amino acids, or herbs. It's intended to be taken by mouth, so no injections, no patches, no nasal sprays, etc. And then lastly, it should be labeled as a dietary supplement. So these are, commonly the types of things you'll see over the counter at your local pharmacy. And then herbal supplements really fall under the umbrella of what's considered complementary medicine or alternative medicine. Complementary medicine is using basically care approaches that are not considered conventional Western medicine, so including supplements, herbal remedies, but also things like massage therapy, aromatherapy, acupuncture, massage therapy. So this all kind of falls under this umbrella. Complementary medicine is when these types of non-conventional approaches or non-Western medicine approaches are combined with traditional Western medicine. And this is honestly what most people are practicing. About 30% of all adult Americans use some form of conventional medicine, and about 35% of cancer patients use some form of complementary alternative medicine. Contrasting that to strictly alternative medicines, so this is using these non-conventional or non-Western forms of medicine in place of traditional cancer therapy, such as surgery, radiation, chemotherapy. So there was a recent survey of over 3,000 cancer patients, and as I mentioned, about 33% of them were using some form of complementary alternative medicine. And of those patients, about half of which were using herbal and dietary supplements as part of their care regimens. Other things included things like Tai Chi, mindfulness meditation, chiropractic medicine, things kind of along that nature. And so that's great and probably about what I expected as I was kind of reading and reading up for this talk. However, what was surprising to me is only 30% of patients who are following these practices disclose that information to their doctors. Top causes for this: 1, doctor didn't ask. Seems reasonable, don't ask, don't tell kind of scenario. And then the other top reason is patients didn't feel that the doctor needed to know. So especially for herbal supplements, I'm hopefully planning to get across that it's very important to disclose these things to your care teams. Other things just to note, so what types of patients are generally using these types of therapies? They tend to be younger in age, they tend to be female, and they tend to be better off financially. So that's kind of the group of individuals that we may be seeing using these types of therapies, either in combination with traditional care or without it. So why are patients and individuals choosing complementary alternative medicine, dietary supplements, either in addition to or instead of traditional Western medicine? So reasons that have been described in studies and large surveys. So patients just want to do anything that they can do to help. If you think that this is a supplement, an aromatherapy, a type of thing is going to help either symptoms or helping with the cancer, a cancer cure or a cancer treatment itself, they're going to do it. And I think that seems very, very reasonable. It can be consistent with personal beliefs. So you lose a lot of control with a cancer diagnosis, and the way that an individual may agree or disagree to undergo treatment is an expression of yourself and your beliefs. And so sometimes individuals may use these types of therapies as almost a personalization or an individualization for their own care, almost a form of expression. Similarly, just a desire to take control of treatment. Again, you lose a lot of control with a diagnosis, and there's all sorts of things to adhere to in terms of medications, diet, dealing with side effects, time and appointments, all these types of things. So this is maybe a way to gain control. And then lastly are things like disappointment with conventional medicine, which may include that conventional medicine too expensive, too many side effects, and maybe it lacks the human touch, whereas complementary alternative medicine has maybe more of a personalization to it. So moving on to some of the legal and regulatory issues and laws that really drive the oversight and the commercialization of dietary and herbal supplements. So in 1994, the Dietary Supplement and Health Education Act, also referred to as DSHA or DSHA, was enacted. And this basically amended a law back from 1938, the Federal Drug and Cosmetic, Food, Drug, and Cosmetic Law. And what this did is really reclassify and allow develop a new sector or new segment of medication classification. So prior to 1994, medications that were considered over-the-counter dietary supplements really were going into two categories that never really felt right to people. If it was a more nutrition, aroma, taste type of supplement type thing, it would go in the food category. Not really a great category. Doesn't go in the same thing as broccoli or potato chips, right? And then on the other hand, things that were really used with more associated with health claims went in with drugs. But as we'll see, some of these medications or some of these supplements don't have all of the same research backing as true medications, and so that didn't really fit either. And so a combination of both the dietary supplement industry as well as taxpayers and civilian leadership actually lobbied Congress for this new law and this new classification. And really since then, it's something that's taken off. So today there's over 80,000 dietary supplements on the market, meaning different brands, not necessarily different ingredients. So a few key features of how these dietary supplements are regulated. It's really broken down between two agencies. So one is the FDA, the Food and Drug Administration, and the Food and Drug Administration is really more involved with the safety aspect. And so because this law was developed in 1994, any supplement that was in development or on the market before October of 1994 was actually grandfathered in. And then any supplement or herbal remedy that companies may be bringing to the FDA after that October 1994 cutoff date had to submit some form of safety and quality documentation. Other things that the FDA is responsible for, so there is a safety event reporting system in place. It's pretty accessible just by a simple Google search, and so that's available for clinicians as well as consumers to report side effects. A lot of criticism with this that it's very likely underutilized. However, there's been a variety of probably important removals of potentially dangerous drugs from the market, including medications with inordinate amount of caffeine, for instance, which certain individuals may be very sensitive to, and that the labeling was maybe not consistent with that. And then any new supplements really require what's called a new dietary ingredient application before distribution and marketing. So when you compare and contrast either these drugs that were pre-1994 or the medication or the herbal supplements that were that do require some documentation from the FDA for their herbal and for the new dietary supplement ingredient acts, approval documents. I just want to compare and contrast this to kind of what goes on with FDA-approved drugs and really how different the system works. So FDA-approved drugs really go through 4 steps for approval. The first one of which is preclinical studies. So these are laboratory synthesis and safety analysis through both laboratory studies as well as animal studies. If these are deemed accessible, it goes on to a phase 1 study. The goal of the phase 1 study is to, one, to identify a dose of a medication and also to identify any concerns for safety signals. Once the dose and safety profile has been fairly well established, these drugs move on to a phase 2 trial, usually involving anywhere from tens to hundreds of patients. And really the goal here is twofold. One, oftentimes to identify a specific patient population that may benefit from this medication, as well as really to develop a sense of efficacy, how well the drug works. And then lastly is the phase 3 trial, which the highest quality of which are placebo-controlled and double-blind, and comparing the new drug to whatever standard of care is. So when you compare and contrast all of what goes into approving FDA-approved medications, including chemotherapy and supportive care, it really kind of makes you step back and think what's going into some of the regulations around dietary supplements. And so the health professionals in the room may remember learning about anatomy. This is the anatomy that we need to know about for labeling, because labeling of dietary supplements is extremely important. And this is kind of on the other end of the regulatory requirements of the government and what the government is owing to us as consumers. So this is really the Federal Trade Commission is the other arm of the part of the DSHA law, and they really are responsible for regulating what is labeled to consumers, as well as making sure that fair trade practices and commercialization of dietary supplements is being, fairly represented to consumers. So these are the type of things that need to be put on the label. So I tried to put stars next to kind of each thing that I thought was important. So one, it has to be called supplement facts. These aren't food facts or drug facts. They're considered supplement facts. Serving size is important. Other people may refer to that as dosing, but really it can't be called a dose because it's not a true drug, either over-the-counter or prescription drug. Serving size is the appropriate unit there. Servings per container and amount per serving. So in this case, there's a turmeric, a very commonly used herbal supplement. It's 95% extract. It actually tells you what rhizome organism it came from. So the curcuma lingona, how much, and then what the dose is. So In this case, it's milligrams, it could be grams, it could be units. And then the second part is this individualized component to this product, which they describe later on the label has to improves the absorption of the medication, so this biopurine. So you may see things like that. And then it's important, too, that they mention other ingredients, because patients can have allergies as well. So there's some cellulose and other things to probably help maintain the integrity of the actual capsules. Additionally, labeling of what are called structure function claims for herbal supplements is very important. So where you see it says support joint health, heart health, and overall well-being. These more generalized statements are things that are allowed by the FTC and the FDA to be allowed to say. They can't say, these supplements can't say things like turmeric kills cancer, turmeric prevents nausea, turmeric supports, prevents heart attacks, things like that. They tend to be more general statements, such as supporting health or contributing towards health of a certain anatomy or aspect that they're going for. There is the suggested use, which kind of goes along with the dose or the serving size. And then probably the most important from a more, yes, go ahead.
Is that one label? And if it's the label, in the ingredients, why doesn't it say turmeric?
Yeah, so in the supplement facts is where it says that, yeah.
But it doesn't say, oh, that's other ingredients.
Yeah, and then the other ingredients are probably things that the manufacturer in this case are considering inactive, but still important to list for people that may have, gluten intolerance. Sometimes there's porcine or pork, pig products that are incorporated into pills that for either religious or other ethical beliefs people may not want to consume. And so that's why kind of those other ingredients parts are put in there. But really what they're calling those supplement facts is the turmeric part. Yeah, so right. Great question. They don't really mention that here. And I don't know myself. So this is some of the things that should probably be, better described on the labeling for these types of supplements. So I'm not sure exactly what that is. Sometimes this might be either a small amount of fat, because fat can sometimes affect absorption of medications, and also might be either an acid or a base type material, a very weak one, because the pH or the acidity level of the stomach can sometimes affect the absorption of medication. So that would be my suspicion, but that's an excellent point, and I agree with you 100%. I don't. There's really no indication to someone reading the label what component or what ingredients are in this kind of proprietary ingredient. So. And then the last thing I'll point out on the label before moving on, and even though the FDA is involved with some of the regulatory management of these medications, they're not running these large or overseeing these large randomized controlled trials that we see for a lot of the FDA-approved drugs. And so they have to have the statement that says these statements have not been evaluated by the Food and Drug Administration. Product is not intended to diagnose, treat, or prevent any disease. And so you'll see that essentially on every label you see as you're going down, your pharmacy counter or your, online shopping expedition as well. And then the last thing that I'll kind of mention before moving on from some of the regulatory stuff is another important component that has to do with the quality of the actual manufacturing of these products, and this is called GMP, or Good Manufacturing Process. And this is something that's borrowed from more the food industry, but this is just another set of laws and standards that the actual manufacturing companies need to adhere to in terms of things like safety, both for the consumers, but as well as the individuals working in the facilities, the plants, as well as other things like sanitary practices, other things like that. All right, so getting into some things about dietary supplements. So I broke this up into the good, the bad, and the ugly. So we're going to touch on the good first, because that's always a nice place to start. So some of the good things about dietary supplements, herbal supplements that we may see. So one, as I mentioned before, can certainly add to a sense of control for a patient. There may even be, if there's no harm or drug interactions associated with the product, there may even be a small component of placebo effect that actually may very much help an individual who may be having a hard time going through their treatments. Additionally, there's a lot of benefits within the entire complementary alternative medicine space that have been fairly well studied and even recommended by large bodies, including the NCCN, or the National Comprehensive Cancer Network. So these include things like massage therapy has been shown to improve anxiety, fatigue, and pain. Hypnosis therapy has been associated with benefits of anxiety and stress, nausea, vomiting. Movement-based activities such as yoga, light exercise, tai chi have shown to benefit fatigue and sleep. Aromatherapy for nausea, vomiting. Music therapy, even acupuncture, which may not always be safe for individuals with low platelet or blood clotting levels, but has definitely been some studies in that aspect to potentially show some benefits. So I think those are all things kind of in concordance with your care team to consider and bring up as potential symptom reduction methods. And then lastly, true vitamin deficiency issues can be seen in cancer patients, especially following surgeries, possibly radiation treatment, and is sometimes associated with other drugs that may cause neuropathies that may affect the gut. And so appropriate supplementation of vitamins can be very important to long-term health of the individual, and these vitamins often fall under the herbal or dietary supplement kind of realm. So bad, there's a few things I want to point out, because these supplements can oftentimes can be harmful, and there are certainly safety concerns. So let's go through some of these things. One, particularly for the more herbal supplements, things that are more the Chinese herbal supplements, and true things that are more I'll say plant derived opposed to true multivitamin type dietary herbal supplements. Really, to date, there's limited benefit that this is going to improve outcomes in the cancer population. If you look in large bodies like NCCN and National Cancer Institute, things like that, there's no mainstream recommendations for use of any of the herbal supplements that are currently on the market. Additionally, the herbal supplements are, even if there are studies supporting their use, the potency and quality of the medication or the supplements that are on the market can oftentimes vary widely, and just because something showed benefit in a study, that doesn't mean it's necessarily the same product that you're going to get on the shelf. And so application to even fairly well-designed studies can sometimes be limited just by that. Additionally, safety is certainly a concern. So things like, so the side effect profile of these medications are often really not well studied, and as I mentioned in the last point, the product that you individual may be buying on the shelf may not be the exact same replication of a medication or a supplement that was used in a study. And so the applicability of some of these studies is very difficult, knowing the wide variety of manufacturing practices that may be available in the country. Other things involving safety, we don't know oftentimes too the safety of individuals either very young or very old ages, because we know that metabolism of compounds, whether they be medications, over-the-counter medications, supplements, for a very young individual, a very old individual may be very different. Other things that can be concerning, especially to, just of note, especially for patients with cancer and lymphoma, a lot of reports in the literature of skin side effects associated with radiation. And so, you know, as I mentioned earlier, only about 30% of individuals taking these medications are informing their care teams. And so these side effects like skin irritation with radiation may come up, and it may affect treatment really in the long run, because they might be, your radiation oncologist, for instance, may be going down on dose or cutting off treatments because they think your individual may be having a side effect to you know, the actual therapy, whereas maybe it'd be simple as a radiation herbal supplement interaction that's causing an unknown or undescribed side effect that they just aren't aware of. And of course, the last thing that we would want to do is to limit the potential efficacy of proven therapies. And then the other aspect too is with surgery, maybe a little less part of the standard of care for lymphoma, but another important thing to bring up is that a lot of these medications have drug interactions with anesthesia. So certainly either causing more side effects, making the anesthesia not as work as well, and therefore requiring large doses, as well as effects on platelets, which are, you know, important blood clotting cells, which, when being subjected to surgery, the blood clotting cascade is extremely important for healing, as well as blood loss and things like that. And so those are some of the safety concerns directly that have been brought up. The other thing is drug interactions. So this is questions that I get on my kind of daily practice all the time, and something that I spend a lot of time looking into for patients and for my colleagues. And when I think about drug interactions with herbal supplements, particularly for cancer patients, I think of three different things. So one, side effects may be additive or synergistic. So these are things like the supplement causes diarrhea, the chemo causes diarrhea. That's not going to be great for that patient unless, you know, you like that kind of thing, but I don't know anyone who does. Or there's a little bit of liver irritation, a little liver toxicity with the chemo, generally well managed, not much to do other than maybe dose reductions, things like that. But patient might also be on an herbal supplement that causes liver toxicity. Now you're possibly compromising chemotherapy dose, and chemotherapy we know goes through these rigorous tests to prove their efficacy, whereas oftentimes the herbal supplements are not. And so I tend to recommend withholding those herbal supplements when things like that come up. And when I said these things can be additive, it can either be, this is more like 1 + 1 = 2, little bit of problem plus a little bit of problem equals a little more of a problem, or they can be synergistic. This is like 1 + 1 = 5. So a little bit of chemo on top of with side effect A plus an herbal supplement with side effect A means a lot of problems for the individual going forward, and those, of course, are things we want to avoid. The second, then the second interaction that I worry a lot about, and what oftentimes you actually can find studies regarding, are drug interactions with how the chemotherapy or other medications the individual may be on are metabolized and how the herbal supplement is affecting that. So this is my really lame analogy, so bear with me. But think of being at a movie, a conference. Of course you have your cell phone off, right? And you may come out of that movie and you've got all these notifications on your phone. And you want to clear those off because those little red dots kind of bother you, and you've got friends to text back and notifications to read and all that good stuff. Your liver might be like this little teenage guy going through his stuff in a minute or two, very quickly, without the influence of a drug that may be interacting or allowing the individual to get through their notifications. And then the bottom person may be someone who's not super tech savvy. Maybe they still have the flip phone. And so it's taking a lot longer for that person to kind of get through and digest all of those notifications and things that they need to do. So on the bottom pane is what this looks like kind of more on a chemical standpoint. So using a old school drug like ifosfamide goes through the liver in the presence of a herbal supplement that may be inhibiting the metabolism of important enzymes that break down that medication. You may have very high levels of the drug in your system under the influence of the herbal supplement, where it can't be broken down and cleared by your body through natural pathways. And that tends to involve a lot more toxicity and a lot more side effects. And then the last thing that I think about when it comes to drug interactions is antioxidants. A lot of the herbal supplements, and sometimes this is some of their key features, is they have very high antioxidant potential. Well, the thing is that some chemotherapy, not all, actually uses an oxidation pathways for cancer cell, tumor cell killing. And so generally you don't want to limit that activity through an antioxidant effect. And interestingly, antioxidants and patients with cancer receiving chemotherapy has been studied in different ways, and some of the studies say, the antioxidants actually protect healthy tissue, and so you get less side effects. And then there's some studies that say, which is my concern, is that there's limited efficacy and the medication's not going to work as well. And so this is another thing that I'm commonly looking into when I get these types of questions. A few more things, too, before we get to the kind of the ugly side of things. Two other things, so misinformation is really rampant, and especially with the internet these days. The regulatory bodies that are really responsible for limiting some of this information out into the public are really not able to keep up. Like I said, there's 80,000 supplement products on the market, and lots of times marketers find ways to get their message out to individuals that honestly may be kind of gullible or in a bad situation or a desperate situation where they're really taking advantage of those individuals, and that's really the last thing that we want to happen. And then lastly is cost. So certainly We know that chemotherapy and medications are extremely expensive, but herbal supplements too can be very expensive as well. It's a $30 billion industry, and on a very informal Google search that I did, I saw some products on the market up to $160 per bottle. So definitely not small prices, especially when some of the benefits or efficacy have been questioned in the past. And then lastly is kind of the ugly. So severe liver damage has been associated with herbal supplements. There was actually a report from a few years ago that said 20% of all acute liver injury, this is like severe acute liver injury, like in the intensive care unit type thing, was due to herbal supplements. Luckily for the cancer patient, most of these supplements included things like anabolic steroids, like people that use for muscle growth, for working out, as well as weight loss products, which generally cancer patients are not taking, but certainly a concerning number. And a lot of these were associated with a lot of these kind of multi-agent Chinese herbal type medications. And even up to 10% of these were reported fatal. And then to add on to that, in countries that use even more herbal supplements, including Singapore and Korea, the percentage of liver injury that was attributed to herbal supplements was even up to 70%. So it's really a concern, and it was something that that was enough to kind of gather a meeting of hepatologists, liver doctors that try to kind of convene and try to look at this from more of a public health standpoint, which is the report that I got this information from. And then secondarily, really probably something I think probably a lot of clinicians have at least suspected for a long time, but there was a recent study published in a JAMA Oncology, very well regarded journal last year, and they looked at, so they compared patients with curative cancers that used alternative medicine. So not complementary alternative medicine, not using herbal supplements and Reiki, massage therapy, things like that, in conjunction with traditional therapy, but patients that use true alternative medicine, so using holistic or non-Western therapies in place of conventional treatment. And these patients had an increased risk of death, so it's not, and up to 2 times once you factored out for things like age and severity of their cancer and type of cancer, things like that. And so this is not a small, it's not a small thing to say. There's absolutely an increased risk of death in patients with curative cancer, which a lot of lymphoma patients, as you know, fall under. And so when this study came out, it really struck me, especially when you see people that are maybe going into their oncologist for the first time and scared and concerned, and some of these aspects of more holistic care may sound more attractive. We really have quality data that says it's not. So in my practice, how do I approach herbal supplement questions? So I like to get as much information as I can. So I get all the supplement. I'd like to actually have the patients either bring in the bottles or have them send me pictures through email or whatever of the label, because some of these include up to 5, 10, sometimes up to 15 ingredients in each label, and it would basically be impossible to remember all the individual ingredients that need to be researched. So all the supplements, how they're taking it, as well as the schedule that they're taking on 1 pill twice a day, 3 pills 2 times a day, etc. And then I usually try to get an idea of what the individual may be using it for. Are you using it for symptoms? Are you using it because you read some research that thought maybe this will be an additive effect to your chemotherapy, et cetera. And then once I kind of have an idea of what they're using it for, I ask, well, so has it been helping you since you started? And I, sometimes we'll get varying answers on that. I also get a full list of their medications that have been prescribed to them, as well as researching what chemotherapy regimens they either are currently undergoing or have underwent, and what over-the-counter medications they're on. Then really once I have all that information, I'm reviewing the FDA safety websites, and there's a few other resources which I'll provide at the end of the talk that I'm reviewing, as well as other primary literature of pharmacokinetic reports that may clue in to see if there's drug interaction or antioxidant effects that may deter or recommend the patient to either continue or discontinue the herbal supplement that they may be taking. And we'll see too, there's a variety of information out on some of these supplements. Sometimes there's dozens of studies published, and you can say with fairly well confidence it's either safe or unsafe to take. But sometimes there'll be a real scarcity of evidence, and I take kind of a guilty until proven innocence approach to these types of treatments. Meaning, I'll really recommend withholding or discontinuing these herbal medications, even if they're in the absence of data, because I just can't say with full integrity that it's okay to take. So okay, perfect. All right, so we'll move on a little bit to CBD oil. So a little background on CBD oil. It comes from the plant Cannabis sativa, and it's a plant that basically, there's two strains. One strain is marijuana, which has high contents of both the CBD as well as THC, which is the component associated with the high or psychoactive component of marijuana. And then the other plant is called hemp. And hemp was specifically grown and cultivated for really more industrial type practices, including fabric and other industrial processes, and contains appreciable quantities of the CBD oil. CBD itself is non-intoxicating, whereas THC is associated with that intoxicating effect or that high. And there's been really a lot of studies that have gone on with CBD itself. Many of the true high-quality studies have shown some benefit, but generally limited in things like pain, neuropathic pain, for instance. But there's still not a lot known about CBD oil. Some of the proposed benefits of it include pain, as I mentioned, improved mood, improved metabolism, and even possibly some benefits in reproduction in individuals that may be having a hard time getting pregnant. And it's even been incorporated into pet food itself, which I probably wouldn't recommend, but this is happening. It's on the FDA website. And really, in my research, I think what's probably limiting a lot of the maybe benefits that CBD oil could be obtaining for patients is that we don't know much about the dose or the pharmacokinetics of CBD oil itself, and really what is optimal depending on what type of effect or what type of target you're trying to go for. So for instance, depending on the route that CBD oil may be administered, including nasal spray, topical, or oral ingestion. The CBD is actually can be in an individual's body anywhere from 1 to 5 hours to up to 24 to 48. And then even if it's taken with different types of food, it may affect the absorption as well as how long the CBD is persisting in the body. In terms of the legality of CBD, you see this all over the place. I saw it in the gas station the other day. So what's with the spike in popularity, and how is this kind of allowed most recently? So the legal background, back in the 1970s, the Controlled Substance Act actually outlawed hemp because of its association with THC and marijuana, even though they are technically separate plants. Then in 2014, this was further delineated by the Agricultural Act that distinguished the low THC hemp from true marijuana. There's still kind of a lot of regulatory issues around this in terms of crossing state lines and other things that are kind of very specific and dry from kind of a legal standpoint. But really these CBD or cannabinoid oil derived drugs are now considered legal and are available for purchase by individuals. And then just as a side note, there are 3 FDA-approved cannabinoid drugs that are on the market. So dronabinol or Marinol can be used for appetite in patients that have appetite or nausea. Similarly, something called Nabilone, probably a little less used in clinical practice. Sesamet is the other brand name for it. Can be used for either cachexia, muscle wasting, and nausea. And then sometime about last year, a very cannabinoid product called Epidiolex was approved for very rare seizure syndrome in pediatric patients. And so I mentioned this just to just to compare and contrast some of the products that we may be seeing on the shelves at our pharmacy or convenience stores, et cetera, versus some products that have really shown true efficacy and true benefit in individuals. A few other things to mention with regard to CBD oil. The actual manufacturing processes are overseen, but there have certainly been reports to the FDA of higher THC content than legally allowed in these products, and so there may be some issues with possibly manufacturing problems, or maybe people intentionally trying to sell true marijuana related products on the legal market. The THC content of the CBD oil or the hemp products by law is required to be less than 0.03% by dry weight, and so this is very small quantities of THC that are legally being allowed to be in the products. It's CBD oil is not FDA approved, and so your physician, for instance, cannot prescribe it. They can only recommend it, kind of more similar to like an over-the-counter product. Doctors are oftentimes writing prescriptions just to have the instructions and everything there, but they're not truly prescribing the medication. It's being bought over the counter, so it's a similar kind of concept. And then what do we know in terms of the safety and drug interactions of CBD? Most of the studies have shown that it's actually fairly well tolerated. The main side effects being somnolence, decreased appetite, and diarrhea. So in a cancer population, those are 3 things that I worry about as a pharmacist. So fatigue, somnolence, very common in patients undergoing chemotherapy, keeping up weight due to appetite or nausea, vomiting issues with patients undergoing chemotherapy, also issues, and then a lot of chemotherapy as well, or supportive care medications are diarrhea is a common side effect. So I do worry about that somewhat, but probably in general, I think the early safety signals that we're seeing with this is that it's fairly safe, and probably why we're not seeing, mass removal of CBD oils and such from the market through higher levels of the FDA. Additionally, drug interaction studies are fairly limited. However, in general, it appears to be fairly safe. The main drug interactions that have been identified are with a very commonly given blood thinner called warfarin or Coumadin, which is really a medication fraught with drug interactions, very well known for individuals who maybe have taken this medication or have known people on it, as well as anti-epileptic drugs, which are another class of medications that tend to be associated with a lot of drug interactions. So for people that may be interested in CBD oil for any of the number of potentially purported benefits, I think it's important to choose a quality product, and so there's been a few standards that have been reported from experts in the field of CBD research. So one of which, so questions to ask: is it meeting any of the following standards? Is it meeting the good quality manufacturing processes? Also, a lot of the CBD oils are made in Europe, Australia, and Canada, and oftentimes the organic certification associated with those countries are indicative of a quality product, as well as the National Science Foundation international certification. Also, does the company that is producing the product, do they have an independent adverse event reporting system, for instance, on their website or even maybe their social media? Is the product certified organic or eco-farmed is another thing that's been associated with quality of CBD products. And are there laboratory testing that can either be identified on maybe a website or a package insert of the product that confirm that there's less than 0.3% of THC or other heavy metals associated with the product. So those are all things to kind of ask in terms of is this a high quality CBD product? All right, so I'll wrap up a bit with some things that you can do. So if you're interested in an herbal supplement, it's very important to disclose this to your doctor. If you have a pharmacist that works with your physician that has access to all your medical records, I think asking him or her is very important. Don't exceed recommended doses. Very important to keep track of what you take and only start one supplement at a time. Starting several products at a time, then you get a side effect. It's unclear what's causing what. And then if, if there's an individual, specific aspect or goal that you're looking for a herbal supplement, what are you looking for? And, if it's better digestion issues, if it's more energy, things like that. If there's any research on the average onset of that effect, see if you're getting that effect, and if there's information on the onset of that effect, see if you're actually achieving those goals. If that goal isn't really met by the product, it might be reasonable to discontinue it. And then choosing high quality brands, so either consumerlabs.com is a good website that is associated with independent quality of herbal products, as well as the U.S. Pharmacopoeia Convention, or USP. Also, don't trust labels or other marketing materials. I think using a clinician, such as a physician or pharmacist, to help you research well-validated websites and other resources is really the safest way to go with these supplements. And then lastly, the FDA website does have this great safety alert program that can be utilized. These are two really good websites. The first one is the FDA through the NIH, National Institute of Health, fact sheet list. And then the last one is a website associated with Memorial Sloan Kettering Cancer Center, and they have a really well-researched herbal supplements database that's very very well-researched and very well-documented information on there that's fairly consumer-friendly as well. And so those are two things two great resources I would recommend. And that's all I have. I'm happy to take some questions. I talked a little longer than I thought, so hopefully there's some questions. Thank you.
Thanks for watching this broadcast from the 2019 Lymphoma Research Foundation Ed Forum. If you'd like to see some of our previous discussions, you can always click back in the Videos tab on our Facebook page. And if you're looking for more information, you can always head over to lymphoma.org. Hope to see you at our next chat.